The head of the World Health Organization, Tedros Adhanom Ghebreyesus, is in Lusaka for a regional health forum.
Today,
Zambia's president, Hakainde Hichilema, is also attending. African governments are under pressure. Recent funding cuts by international donors have affected public health care across the continent.
We have felt it. When we look at our HIV performance, TB and also malaria, you compare the period from January to March, we saw a dip in the number of people that were accessing HIV services. The testing services, they dropped. But also we saw that there are certain facilities which were closed, especially for prevention.
President Donald Trump's decision to suspend most U.S. financial assistance for humanitarian aid programs came as a shock.
The cuts were too fast, too sudden, too drastic. And so most countries were ill-prepared. We had collectively, in support of African governments and African ministers, had already begun to prepare what we call sustainability roadmaps, which were defining how countries would increasingly take over the funding to HIV/AIDS. But this came so fast that there was no time to plan accordingly.
Other governments, including the UK, say they are also scaling back, making an already dire situation worse. Zambia was struggling even before aid budgets were cut. This is a public hospital in the capital, one of the largest in the country. Like many other public health facilities, it's sometimes overcrowded. There's a shortage of drugs, and staff say they are overworked and underpaid. African governments are no longer getting as much financial support as they used to from the West. Health ministers at this meeting have to find ways to fund their own health sectors and rely less on foreign aid and donations. Haru, Mutasa, Jazeera, Lusaka.
Don't miss out and get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.